Hello there. My name is Dolores Andrew and I'm Healthy Club Officer with Salthill Knocknacarra GA Club. And I'm interviewing a series of people coming up to World Mental Health Day on October 10th. But these, of course, are conversations that are applicable any time of the year, not just on one particular day. So I'm delighted to be speaking this morning to the CEO of Let's Get Talking, which is an organisation in Galway. And, you know, it's one that really encompasses everything that we're trying to do with these interviews. So I'm talking to Cyril Hyland, who is the co-founder and CEO of Let's Get Talking. Cyril, you're very welcome and thanks for coming along to talk to us this morning.
Thank you very much, Dolores.
Okay, so, you know, as I said there, it's lovely to get away from the whole idea of World Mental Health Day being just one day. But I guess it's very important that it is recognised in a day, in a week or whatever, I suppose, to bring awareness to it. So I'd love, Cyril, if you could take us on the journey of Let's Get Talking, you know, why it was founded in the beginning and your journey with it until now.
Yeah, well, basically, Let's Get Talking as a counselling and psychotherapy provider is, I suppose, it's different and unique in the sense that what we sought to do in the beginning, sort of, just to set the background, you have private provision in the community, and then you have government provision or provision through primary care and so on. And if you like, we're trying to straddle the gap between the two, because we found that in order to reduce barriers to access, we had to take a number of things into account. One of them being in terms of government provision, there was very little of it. And also, it was very much under-resourced. And you see waiting lists and all the usual stuff that you hear in relation to that. And on the other side, then you have private provision, which was often outside the means, if you like, of many members of the community. So we came up with a model then where we decided we'd have a non-set fee policy, for example, in Let's Get Talking, which allowed people, irrespective of their income, to set their own fee as to what they would pay. And it can vary then from anything from very little in the cases of people that are poorly resourced to people, you know, who can afford to pay what they might pay private. So I suppose that's the way we decided to straddle it. And we found, you know, sometimes when you say, you know, we're glad there's so many people coming in here, you could regard that as being that, well, there's a lot of people in difficulty out there, which is a distressing thing in its own right. But in fact, the way we see it is that the need was there already. The problem is as well that, you know, the whole area of talk therapy was something that wasn't used that much in the community up to recent years. And as many GPs will tell me, the reason they medicated people so much was because they had no pathway in which to direct people. Mm-hmm. And hence now, around 70% of the people who come to Let's Get Talking, although they can self-refer, but 70% of them are referred by GPs. So there's a culture of talk therapy that has developed as a result of, well, two things, the counselling and primary care itself, but also the availability of service, which we're glad we provided because it's obviously needed. I mean, prior to COVID, for example, we had 200 sessions a week at the centre here, and we opened in Dublin later than that. It's not as big as that, but it's also growing there. And now, as a result of the COVID situation, we're doing a lot of online as well.
That's phenomenal. Phenomenal. Well done, Cyril. And I love the fact that the theme for Mental Health Day this year is inclusion, mental health for all. So I think really, you know, going back to when you saw there was a need and that perhaps it wasn't inclusive because the price was prohibitive of private for some. So I think that it's such a wonderful theme to have this year. And well done, 200. I mean, I would like to say well done because I think it's phenomenal that you offer this service to so many people, and especially COVID is a whole new different area for mental health, but like that this service is there and has been there for so many years. So it's great also to hear you say that it's actually referred by doctors now, and because that culture around mental health. You know, when we have, like, we all have mental health as well as physical health, and it's the divide, really, isn't it, between, you know, if we tell someone we're physically ill.
About that, actually, it's really important as you raise that point, because you see, there has been for a long time now a big focus, as rightly there should be, on physical health. Mental health, in my view, is equally important, because if you're to take a holistic view of individuals in the community, I mean, one of the yardsticks by which you measure contentment and happiness and all of that type of stuff, one of the yardsticks is the quality of mental health and wellness. So, but I mean, unfortunately, I mean, one of the things that happened in this country when we had the vision for change, where the government decided, for example, to do away with the institutionalized response to mental health problems, particularly at the more acute end. They said then that there was going to be a community focus to replace that. But there's actually less of a percentage now of the health budget being spent on mental health than there was way back then in the 80s. So, you know, there's a lot of talk about mental health, but very little substance when it comes to actually providing the resources to do it. For example, you know, another issue in relation to this, everybody wants to be seen to be responding to crisis now in this country, and God knows there's plenty of crisis around. But, you know, the whole area of suicide, and which is very prevalent, unfortunately. But I mean, there are many pathways to suicide. So in my view, you know, the single issue organizations, for example, like Pieta, some of those, they're very necessary and doing a great job. But I think we need a more nuanced response than just responding like fire brigade to crisis by really having what would sort of preclude the need in the future for radical psychiatric interventions would be to have a preventative response by way of talk therapy, counselling and psychotherapy, which, you know, and we do have a lot of young people coming to the service who, you know, there's nothing wrong with them as such, but they're encountering, you know, the stresses of just living everyday stuff, everything from relationships to addiction, sexual trauma, you name it. There's so many things. And now on top of all of that, you have the crisis of COVID, which is having a huge impact on people's mental health. And a lot of people for a long time didn't fully appreciate the effect that was having. But I mean, at the end of the day, we're relational beings, and all this talk about lockdowns, and I mean, the world at the moment, I think has, particularly since COVID. Sorry, my phone is going off here.
Don't worry about that.
Since COVID started, there's been a lot of extra pressure on people, even things like, say, relationships, personal relationships, but intimate relationships like marriages and so on. And we're finding that a lot because, you see, people had a huge sort of a cocktail of support in when things were normal. There was relationships at work, sport, football, training for young people, all that type of stuff, and you'll be aware of that. And as that is being cut back, then, if you like, the onus then comes back onto the personal relationships to provide for the person's all their needs. So the personal relationships were being scaffolded in normal times by their interactions with other people. But now, if you like, we're expecting all our needs to be met in the one place, and it's just not possible.
Wow, that's very well put, actually. I think that's a phenomenal way to put it, and so true. And you do hear the talk about, I mean, I even saw it with my, you know, I saw it with my own kids and that, and myself, you know, we're made for connection. We're people connect with people buy because of how something makes them feel. I mean, it's that emotional state, isn't it, that we need with connection. And you also brought up another, you know, very good point as well about, and it's something that I can never understand why there is such a big stigma. And I know it's a huge topic and not one for today maybe, but like there again, it's the mental health and the physical health. It's a holistic view. But I think even that word holistic for a long time had a bad name, a bad rep. You know, it's like, that's over there, you know, but when you look at something holistically, as you say, you're looking at the whole person, because there's no point being the fittest person in the world if your mental health is, you know, if you're suffering, should I say, because we all, as I say, and now we can all suffer at times, and there's no doubt about that, but we need to look at the whole approach.
even see that in sport, in Gaelic football. When I was playing Gaelic football, the psychology was a kick up the arse if you didn't do it right, you know. But now you
Yeah.
can see back teams, and you can see a more holistic focus in terms of teams, player development, and so on, both at an individual and collective level. So there is a realization out there that actually how we think and how we feel about things has a major part to play in actually how we are in the world, whether it's in sport, work, however it is.
And that's so true. So, I mean, you saw this gap, and you're now, like I would say, a scaffold as well, a part of the scaffold for people that they can actually reach out to Let's Get Talking. And let's say there is somebody out there that's wondering, you know, I don't know whether I am or not. I'm feeling a bit, you know, my thoughts, my feelings, you know, what do they do? And, you know, talk about the whole online experience, because that is another thing. There again, the connection seems to be gone again with sitting down one-to-one with people. So can you take us on a little journey, like of, let's say, someone that's listening to this and that wants to reach out to you? What do they do?
Well, basically what they do is contact the centre, and the phone number for that is 091 765 500, and seek to make an appointment for an assessment or an intake interview. And that will be dealt with on that basis. We have somewhat of a waiting list, but depending on the degree of need on the part of the person that's actually looking for the appointment, we will adjust the waiting list accordingly as well. Because, for example, if somebody was in crisis, we would see them a lot sooner than just leaving them on a waiting list. In terms of, you raise an interesting question in relation to the online. You know, personally, I didn't think that online would work as well as it has. I'm pleasantly surprised by the fact that, you know, that we did take the sort of decision to turn the crisis into a bit of an opportunity in terms now that we've got more reach now as a result of the online. It's not the same as you say face to face, but it's pretty close to it. And what I found myself was I didn't think it would be half as good as it was from my own point of view. But what clients are finding as well, that they're pleasantly surprised by it. And what a lot of, you know, insofar as we're allowed by the regulations, what a lot of counsellors for our centre are doing now is, so that we don't have large numbers of people in the centre, for example, we're doing, in some situations, say 1 in 4 sessions face to face. So to enhance the connection, because counselling and psychotherapy works primarily on the strength of the therapeutic connection between the counsellor and the client. So sometimes the occasional one-to-one allows that to develop a little bit more easy, and therefore then that enhances the online in turn again. So there are ways around it. And where there's particular clinical need as well, we will also arrange face-to-face in a very safe environment here, because what we have here, we've quite a large centre in the sense that we have in total 9 consultation rooms, but some of those are not quite large enough to operate safely. So what we do is we use the 4 large rooms at the front of the building, which have ventilation and sufficient space for social distancing to allow that to happen. So, you know, in 80% of what we're doing now is online, but we still do provide some. In specific circumstances, we still would provide some face-to-face as well, where that's absolutely necessary.
That's fantastic. That's great to hear, and it's great that you have that facility now, isn't it? That, you know, we're all under pressure with restrictions and everything, and it's great to hear that you actually are set up to do that. So let's say, you know, I'm here on behalf of Salton Lochnacar, as I say, a club environment. You know, what are the age groups that you would provide services for? Just, you know, this is going out on our YouTube channel, and, you know, it will be shared with our members, our coaches, and our wider community. Can you let us know what kind of people can come to you, or are there restrictions or whatever?
Well, basically, and I suppose the answer to that question also speaks to something we spoke about earlier in terms of a comprehensive response to the needs in the community. For example, between the organisation in Dublin and all, and indeed, well, in terms of online anyway, is up now close on 100 actual therapists, right? So the benefits of that, and this is something that the GPs seem to like about our organisation. We do an intake assessment interview with people, but that's made pretty easy to do and easy to refer people then when we have a very broad range of specialities in the sense that particular therapists have particular sort of skill sets,
Sure.
areas of interest and so on. So basically, look, I'm not saying that we have any magic wands in here, but there's little if any sort of presenting issue that we can't make a response to, in the sense that there will be people that might concentrate on addiction, anxiety, depression, food disorders, sexual trauma, you name it, all of the right across the board. We have relationship therapists. So I would say to the people that you're speaking to me about, that any issue that's causing them distress, they can present and we can help them. I'm not saying that, again, it's not like it doesn't work like a tablet therapy.
Mm-hmm.
It's not like that. It involves engagement from the person themselves, and it often involves a lot of work as well over a period of time. But it's, anecdotally you can see there is much obvious evidence-based research to say that talk therapy is efficacious. But if you were to meet some of the people here who come through the centre and see how we've enhanced their lives, or they have themselves, and we facilitated that, I think a lot more people we probably would be more inundated than we are. And what I'd say to your people in Knocknacarra and the football club especially, whatever the issues are, whether it's, and I'm aware that there are some issues that are particular as well to the sporting area, like addictions. Gambling has become a huge issue in society generally, but particularly acute within, if you like, the higher skilled areas, the more, if you like, the inter-county senior club and stuff like that, because performing at that level is quite a drain on the resources of any individual. And I suppose the outlets, I mean, talking about COVID, for example, a lot of senior players, whether it's hurling or football now, would be making the same commitment in terms of personal sacrifice than most people in the community are now over COVID, because they would be doing that if they're playing at a serious level all the time. So the stresses are there. Are there.
Absolutely. And we have 4 codes in the club. So, we have ladies football, and we've camogie as well as and hurling as well as the football. So it goes across the board, as in like it's I want to include everybody, not just the footballers.
What happens as well is young people, particularly maybe underage people like adolescents and so on, young adults, because they're involved a lot in that. They're the people we're talking about in sports clubs. We also have therapists here who are qualified to deal exclusively with adolescents and that service as well. So I think we would be particularly useful for an organisation like yourselves, and we'd be glad to help if we can do that.
Fantastic. So is there, I mean, our membership ranges from very young to, whatever age. So is there a cap on like, does somebody have to be a certain age before they can actually call you, like 6, 7, 8, 9? Do they come with parents or?
You did ask me before the age range. It's anybody really.
Okay, that's good to hear.
12 years of age, 13 years of age who come to our service. We have people in their 80s.
Perfect. That's great. That's great. And I think I know I'm a coach myself and a therapist. So, I think that there's a certain age where I would see anywhere where it's easier, almost like when a child is about 9, 10, they're more kind of, I suppose, cognitively even aware of their emotional state. It's easier to understand, maybe to put a distance between, I'm feeling this because of that, and root cause, etc., etc. So, yeah.
Well, touch with their emotions, because by the time you get to, I don't know about your age, but certainly to my age, it could be kicked out of you nearly at that stage. You know, you're kind of inclined to disconnect, and we're inclined to rationalize everything. And if there isn't a ready explanation for something, it's catastrophe. You know, we catastrophize a lot. The only thing about in the COVID situation now as well, for sports people and everybody else, I suppose a lot of the work we used to do was irrational catastrophization of problems. You know, irrationality, irrational thinking. The thing about it is the dangers out there now are very real. So it's not irrational anymore. So it's all about learning coping mechanisms, isn't it?
I love that. I love that you brought that up, you know, because like our basic needs are being rattled at this stage. Like that, you know, like I work a lot with Maslow's hierarchy of needs, and you know, it's that basic instinctual needs of safety and belonging, rather than the even reaching our full potential at the moment. I think if you don't feel safe in your basic needs, it's very hard to start looking and saying I'm not living to my potential, because those needs aren't even being, you know, they're not at the foremost at the moment.
Of even that goes right down to personal and intimate relationships. You know,
Yes.
Some people were stuck. So when this all started, in relationships that they weren't too sure about anyway.
Yeah.
And then you have the people who are single who can't have an opportunity to become any other way at the moment as well. So there's challenges no matter what way you look at this. And I mean, I'm hoping that we are going to be able to continue. I'm confident that we will, but make an impact in terms at this difficult time, really, for, you know, because it is particularly difficult at the moment. And, you know, who knows what's going to happen in the future in terms of COVID and so on. So.
Well, Cyril, it's great. I mean, I'm delighted to share what you do. I mean, I have done some, you know, I've done some fundraising. I've been on a carol singing one Christmas. I just know the girls that is involved with yourselves. So I have been aware of your organisation. I didn't know the extent of it. So it's phenomenal. And I'm delighted to share it with the wider community in our club here and beyond. Is there anything you'd like to leave us with that we haven't touched on in relation to, say, Let's Get Talking itself?
Well, I mean, I'd just like to say that, you know, you mentioned inclusivity. I mean, our plan and our aim is to provide this service throughout the length and breadth of this country.
Wonderful.
It's where the main sort of hub of it is at the moment. But my wish would be, I suppose, that we can manage to sufficiently sort of maintain and develop the resourcing of the organisation, and that's always a concern. While we are a non-for-profit, you know, it still has to be run like a business, because if we can't survive, I think, you know, a lot to do. It is an awful lot to do in terms of the day-to-day running, as well as the mission and the sort of vision of bringing mental health services to the community at large. In order to be able to do that, we must remain viable. And with that in mind, I suppose we're constantly on the lookout for ways that we can, if you like, develop and extend our the sort of means of income and areas of income where we can actually further develop. There's so much more we could do had we the resources to do it. And, you know, I think in the circumstances, we could be waiting a long time for state funding.
So if people had an interest in that particular area, can they go to your website and find out more? Absolutely.
Eamon Kelly is our communications and fundraising manager, and any initiatives or any way that people can help, they'll make an untold impact in the wellness of people that they might know or not know in their own community.
Well, I'll share a link to your with this interview with where people can contact for both, obviously reaching out for help and also for perhaps anything else as well.
Yes, and any by way of, say, donation or any help that we get, we will, it will go directly towards enhancing the delivery of service.
Well done, Cyril. You know, it's great, and I'm delighted to be able to share the wonderful work that you do. I think it's important that more people know about it. And keep up the good work. Yes.
One thing. Sorry. it's not just me. I basically coordinate the huge efforts that other people are making. You know, and Elaine Ryan, who's the person that worked with me in setting up the organization, and now we have other people like Laura Condon and so on, and people who have developed with the organization. And you know, one person can't do something like this. You've got to have assistance and support. Thanks.
That's great, Cyril. As I said, thanks again for coming on, and keep up the good work.
Thank you, Dolores, and you too. Bye-bye.